Welcome to Coloplast Professional. This webinar will focus on outward body profiles, assessing parastomal body shapes, and will last approximately 45 minutes. We hope you find the following information helpful in your nursing practice. Please take a moment to read our legal disclaimer. Also, any products in this presentation are for educational purposes only. Thank you. My name is Sarah Warmby, and I have been a certified wound ostomy continence nurse for over 8 years. My practice has been in the inpatient and outpatient settings within an oncology institution. Let's talk about the importance of fit. Leakage still remains the biggest issue in ostomy care. According to the Ostomy Life study, 80% experience leakage regularly. The Ostomy Life study is an ongoing study of over 4,000 people with an ostomy, with at least a quarter of the participants from the United States. The aim is to raise awareness about important aspects of ostomy care by sharing evidence-based data and clinical insights in order to improve the standard of care. A secure fit to the body is important to prevent leakage in the first place. According to the WOCN clinical guidelines of 2018, leaking can be avoided by choosing a properly fitting pouching system and by using ostomy accessories as needed to fill in areas of the skin where leakage could occur. Yet further defining how to obtain a secure fit to the body can be challenging. Why? Because all bodies are different. I think we all can agree that we all look different. That is definitely also the case when having an ostomy. Coloplast embarked on the journey of focusing on the parastomal body profile to understand why leakage was still a huge challenge for many people with an ostomy. It became clear that there was no common language, and hence it was very challenging to reach a deeper understanding of the practical challenges of the patient. To give you an example of how many different words can be used to describe an ostomy and the surrounding area, let's take a look at a couple of examples together. Here is a closer look at this parastomal area. How would you describe this parastomal area? Write down your responses on a sheet of paper. Here are just a few terms you may have used to describe this area. Red, raised, variable, and a protruding stoma. Let's take a closer look at this case. How would you describe this parastomal area? Write down your responses on a sheet of paper. Here are just a few terms you may have used to describe this area. Recessed, inward, deep folds, creases at 3 and 9 o'clock. To describe these differences, there is a need for a common language. Would you agree? Hopefully you'll see the need for the common language, and the solution we would like to present to you is what we call body profile terminology. Body profile terminology is simple and consistent lexicon for describing parastomal body shapes. It has been developed in cooperation with specialist stomacare nurses from the Coloplast Ostomy Forum around the globe, and has helped in guiding the product development in Coloplast. This we will elaborate later on in this presentation. Body profile terminology consists of 3 overall categories: regular, inward, and outward, with further refinement using subcategories: uniform or variable, soft or firm, superficial or deep irregularities, stoma location, and stoma opening position. The purpose of using the predefined terms is to ensure common understanding on how to assess the parastomal body profile. We will dive into definitions of each of these on the following slides. You may have seen this terminology already in some tools, including the body check assessment. Please note that the body profile terminology and the body check tool are different than the skin assessment tools you may have familiar with. While the various skin assessment tools assess the skin specifically, body profile terminology is meant to guide your assessment of the patient's overall body shape. Based on the hard work from both national and global cough boards, the key overall parastomal body profiles segmenting the bodies into 3 categories to describe the form of the area around the stoma were defined. The 3 overall categories were regular, inward, and outward. Regular. The parastomal area is more or less level with the abdomen, although the skin surface may be uneven. Inward. The parastomal area sinks into the abdomen, creating a hollow or a dip. And outward. The parastomal area rises from the abdomen, creating a peak, such as with a parastomal hernia. Step 2 is selecting the form of the area around the stoma. Is it uniform or variable? Uniform is more of a consistent region around that stoma. Variable is inconsistent, so there could be a crease or a wrinkle around the stoma. Step 3 is the abdomen soft or firm. Soft, the area yields to pressure. So whenever you are palpating around the stoma, it is very soft, such as pressing a balloon filled with water. Firm, the area resists pressure. So when you are palpating around the stoma, it is firm to touch, such as pressing the bottom of your heel. Step 4, are there superficial or deep irregularities around the stoma? Superficial creases, such as wrinkles around the stoma. Deep folds, so deep folds including loose skin, or there could be some excess fat. It could be unilateral or bilateral. Where is the stoma located? Is the stoma above the bending line? At the bending line, which you will see creases at 3 and 9 o'clock in those cases, or below the bending line? What is the position of the stoma opening in relation to the surface of the skin? Is the stoma above the skin level, where the stoma protrudes? Is the stoma flush or level with the skin? Or is it below the skin surface, such as a stoma that's retracted? Now let's take a closer look at this parastomal area using the body profile terminology. What is the form of the area around the stoma? In this case, this is an inward body profile. The stoma is essentially sunken into the abdomen. Is the selected form of the area around the stoma uniform or variable? In this case, there is a bit of variability. There are creases at 3 and 9 o'clock, but they're not exactly the same. Is the abdomen soft or firm? This can be difficult looking at a photograph, so of course in person you will be palpating the abdomen to see if it is soft or firm. In this particular case, the abdomen is on the softer side. Are there superficial or deep irregularities around the stoma? There are deep folds at the 3 and 9 o'clock, but as you can see, they are not identical. Where is the stoma located? This is also a little bit difficult via photograph, but sometimes when you have patients sitting down and they bend over, and you have creases at 3 and 9 o'clock, that's exactly where their bending line is. So in this case, this is at the bending line. And lastly, what is the position of the stoma opening in relation to the surface of the skin? In this case, the stoma is level with the skin surface. However, there is a slight protrusion right at the center of the stoma. As you use this body profile terminology, keep in mind there are no right or wrong answers. This is used as a guide. Now that we have established a common framework for talking about body profiles, let's zoom in on the outward body profile population. Here you can see the share of people living with a different parastomal body profile. According to an online survey, including 13 countries involving the US, 50% stated they had a regular body profile, 15% inward, and 35% outward. So having an outward body profile is actually quite common. Think about what the percentages would be in your area. Let's take a moment to think about the typical causes of an outward body profile. Write your answers on a sheet of paper. Some typical causes of outward body profiles are being overweight, obesity, having fatty tissue that forms a bulge around the stoma, and also hernias, such as a parastomal hernia. As you can see, statistically speaking, the majority of people with an outward body profile are male, age 60 or above, and have a colostomy. Quite a lot of people living with an outward body profile also struggle with overweight or obesity. So let's look a bit further into this. A higher number of people with inward and outward body profiles experience leakage compared to the regular segment. Usually, the inward body profile is considered the most challenging condition. But according to this data, this is not the case. They are equally challenged by leakage. Also, people with outward body profiles have the lowest quality of life score. Think about the challenges you face as you care for your patients who have outward body profiles. Is this a challenge that you see every day? Living with an outward body profile poses its share of challenges. Let's take a look at how to solve some of these challenges. Meet Benti. Benti is giving us a peek of her ostomy pouch while wearing clothes. Think about what her stoma and peristomal region may look like without the pouch. Take note of her waist and her belt line. This is what her stoma looks like without a pouch on. Take note of the granulomas at the mucocutaneous junction, which is caused by friction due to that outward area movement. Let's take a look at how you would describe Benti's body profile using body profile terminology. What is the form of the area around the stoma? Due to the fatty bulge around her stoma, this will be an outward body profile. Is the selected form uniform or variable around that stoma? Now in this photograph, it appears that it is rather uniform. This may change with an in-person assessment, but keep in mind the idea is to assess the skin and the region around the stoma for any sort of variability. Is the abdomen soft or firm? Typically with fatty bulges, it is more on the soft side. Are there superficial or deep irregularities around the stoma? Now in this case, she has more of a uniform region around the stoma, and typically there are no superficial or deep irregularities. You can see slight indentations of where her barrier resided prior to removal, but otherwise she has very minimal creases. Where is the stoma located? Now in the previous picture, I mentioned take note of her belt line and her bending line, which happens to be at her waist, which is above the stoma, meaning her stoma is located below the bending line. What is the position of the stoma opening in relation to the surface of the skin? Her stoma is level with the skin surface. It is flush. Let's take a look at a few potential solutions for Benti. This is not an inclusive list. These are suggestions. In cases like this, a stoma that is flush may need a little bit of stability, so she may utilize a soft convex pouch. For a two-piece option, she may utilize a two-piece click and possibly a moldable ring, which helps maintain a seal directly around that stoma. Benti is also a candidate for a convex flip, which is specifically designed for those outward body profiles. We will go over this later in the presentation. Let's meet Susan. Susan is giving us a peek of her ostomy pouch while wearing clothes. Take note of the lateral view of her abdomen and the outer edge of her barrier. Notice with that lateral view, it's more of a round area around her stoma. This is what Susan looks like without a pouch on. Now let's describe Susan's body profile using body profile terminology. What is the form of the area around the stoma? In this case, she is more of an outward body profile. You can really see that on the previous slide when I mentioned that she has more of a round region around her stoma. Is the selected form uniform or variable? In this case, she has more of a uniform or even surface around that stoma. Is the abdomen soft or firm? Her abdomen is on the softer side. She has just a little bit of fatty tissue around that stoma. Are there superficial or deep irregularities around the stoma? She has a pretty uniform region around the stoma. Therefore, typically no major wrinkles or creases. But I imagine that when this person sits down, she might show a few creases. Where is the stoma located? In this case, excuse me, in this case, her stoma is below her bending line. What is the position of the stoma opening in relation to the surface of the skin? Her stoma is protruding and above the skin surface. Let's take a look at a couple of potential solutions for Susan. Depending on the movement and when this patient sits down, she might utilize a soft or a light convex. Even though her stoma is protruding, sometimes when these individuals sit down, things can change just a little bit, and she might need a little bit of stability around that stoma. Another option would be convex flip, which works ideally for outward body profiles. And lastly, if convex flip is not available, a flat barrier may be utilized by cutting slits around the edges to allow for that flexibility. Let's meet Bert. Bert is giving us a peek of his ostomy while wearing clothes. Take note of Bert's belt line location in this photograph. Bert's belt line is actually above the stoma. So it appears that he actually pulled his pant or belt line down below the stoma for visualization. Let's describe Bert's body profile using body profile terminology. What is the form of the area around the stoma? In this case, Bert has a very clear peristomal hernia, therefore he has an outward body profile. Is the selected form uniform or variable? Now I realize you cannot see the other half on the other side of his stoma, but for the most part it is on the uniform side. Is the abdomen soft or firm? Now typically with peristomal hernias, they are soft, but as a hernia gets worse, it could become firm upon palpation. Are there superficial or deep irregularities around the stoma? In this case, he has very, very superficial creases, nothing major. Where is the stoma located? Above the bending line, at the bending line, or below the bending line? Now I realize in this case, it's very difficult to see this in a picture or a photograph, but his stoma is actually located above the bending line. Even though his belt line is above the stoma, that's where his bending line is. What is the position of the stoma opening in relation to the surface of the skin? For the majority, the stoma is above the skin surface. You can see right at the mucocutaneous junction, the stoma is a bit on the flush side, but the stoma opening or the stoma os is actually at the center and it's protruding, which is above the skin surface. Here are a few potential solutions for Bert. Bert is an ideal candidate for a convex flip, designed for that outward body profile population. If a flip is not available, a flat barrier may be utilized by cutting slits around the edges to allow for that flexibility to conform around that body profile. Excuse me. And lastly, let's meet Ruth. Ruth is giving us a peek of her ostomy pouch while wearing clothes. Take note of Ruth's belt line location. Ruth's belt line is located above the stoma. Also take note of the location of her stoma. Let's describe Ruth's body profile using body profile terminology. What is the form of the area around the stoma? This is a bit tricky. Ruth has a large round abdomen, but the area directly around her stoma is inward. So she's a little bit of both. She has an inward body profile on an outward body abdomen. Is the selected form uniform or variable? In this case, there's a bit of variability. You can see at the 9 o'clock location, there's a bit of a crease, but on the other side at the 3 o'clock, there is not. Is the abdomen soft or firm? Now, depending on your physical assessment, there are some times where obese abdomens are on the firmer side. There are also times where it can be very soft. In this case, it is a firm situation. Are there superficial or deep irregularities around the stoma? I pointed out that there is a crease at the 9 o'clock position. Where is the stoma located? Is it above the bending line, at bending line, or below the bending line? The stoma is actually located below the bending line. Her belt line is above. And lastly, what is the position of the stoma opening in relation to the surface of the skin? Her stoma is actually below the skin surface. Now let's take a look at a few potential solutions for Ruth. Ruth could definitely utilize a convex pouch, whether it is a light or a deep, and that will really depend on her activity and what works best for her. She may even utilize an ostomy belt with that convexity and or a moldable ring to help fill in those creases for an even surface. Solutions for outward body profiles, Censure Mioconvex Flip. It's clear that people with an outward body profile have been overlooked. We have flat barriers for our regular body profiles. We have convex barriers for our inward body profiles. But what about our outward body profiles? Outward body profiles are characterized by three main challenges. The first challenge is that we have flat barriers that do not fit evenly over a curved outward body profile, and this can create creases or channels for leakage. The second challenge is that outward area moves constantly, especially with activity. And the third challenge is that the stoma size and shape changes when the body moves, especially when these individuals cough. Introducing Centura Mio Convex Flip, this is the first pouching system specifically designed for those outward body profiles. Let's take a look at a couple of characteristics of this particular barrier. Centura Mio provides a better fit for outward body profiles with body fit technology that's incorporated into our Centura Mio Convex Flip. First of all, there's a curved star shape. This allows for conformability. Second, there are fit zones that provide flexibility. So you have fit zones directly around the stoma to help with the changing of the size of the stoma and the shape. And you also have fit zones on the outer rim to help allow for that flexibility. And lastly, there is a built-in stability ring to keep the stoma stable around the tissue around the stoma. This also absorbs movement. Thank you for joining this webinar.